Hello. Hello. Good evening, everyone. Am I audible?
Yes, ma'am.
Okay. So, to begin with, we will continue in this 3D webinar series. This will be the second lecture for today, which will let you know about the normal findings generally seen in small animal sonography. So, the first and most important aspect for while performing any sonographic examination is the patient preparation. We need to prepare our patient in advance so that there can be best visualization of each and every organ. So, for that, the first and most essential step is hair clipping. A large area is to be made free of hair so that there are no small air bubbles which are trapped in between the hair, because we already know that air is a barrier to ultrasound waves. So all the hair should be removed, and after that the skin, it should be degreased by using any alcohol or chlorhexidine scrub. And after that, if the time allows, we can put ultrasound gel and we can wait for 5 minutes so that this gel, it just simply gets absorbed into the skin, and later on when we perform the examination, the quality of the image gets improved. However, if it does not allow, then in between repetitively we can use liberal amount of gel to allow a good enough contact of the transducer with the skin and to prevent any air bubbles in between. So, generally, the scan, it should be preferably performed in an area which is very dark, and it is quiet. Dark so that our eyes, it can get accustomed to various shades of gray and we can resolve the image better. And it should be quiet so that the animal does not get disturbed while performing the sonographic examination. We should have a stable table which is not moving, which is height adjustable so that we can adjust it as per the size of the animal which we are dealing. Also, the seating for sonographer should be comfortable. It should also be height adjustable. For the patient to lie down, the bedding should be very comfortable so that we can simply make the patient to lie on that particular area without using any chemical restraint. If very aggressive chemical restraint may be used, like butyrum or xylazine can be given, but actually they have some effect on, suppose they just lower down the peristalsis. So if we want to assess the functioning of intestinal segment, then we have to keep in mind that yes, this animal is sedated. And for performing any sonographic examination, we should do a thorough examination. We should at least spend around 30 minutes. Maybe with time we can do the examination very quickly, but we should perform an in depth examination wherein we should evaluate each and every structure. Post scanning, we should remove the gel from the animal and from the probe also, because we need to maintain the probe so that the functioning of the probe, the quality of the ultrasound waves which are generated from the probe, does not get deteriorated over the time. So in this picture, we can see that enough area should be shaved. We can see cranially the shaving should begin from the xiphoid, and laterally it will continue along the costal arc. It will go up to the level of the sublumbar muscles, and caudally the shaving area will continue up to the level of pubis. Similarly, the shaving should be done on the other side also. Here we can see, and laterally the area should be shaved up to the level of sublumbar muscles. Other things which may be needed is like the requirement of stand off pad. It was generally used in case of mechanical transmitters, but now the probes, they are much better and they are generally not used. However, these stand off pads can still be used when we have to examine very superficial structure, like we have to examine the muscles of the abdomen or peritoneum. In that case, it helps to resolve the near echoes much better, and then we can make the animal to be overnight fasted. See, in some emergency cases, we just have to immediately perform the sonographic examination. But if it is not an emergency, we can schedule the examination wherein the patient will be overnight fasted so that all the contents, intestinal contents, they can be removed easily. And there are less amount of gases, because in gases which are produced in stomach and intestine, they create a barrier and they do not allow sufficient echo window for placing the transducer and imaging the structures. If the animal is very obstruated, we can go for enemas to evacuate, but this needs to be done at least a day before examination. Sedation, as I have already told, it can be used for very aggressive patients. And one thing which is although not in our control, but we can make sure that the animal should drink some water and it should be waited for some time with the owner so that it does not urinate, and there is moderate bladder distension because this bladder, it contains anechoic fluid, and it provides a good echo window to examine many other structures like colon or maybe uterus or prostate organs like that. So these things we should keep in mind before performing any sonographic examination. Then a very important thing is patient positioning. So mainly most of the people when they are right-handed, right? So I will tell this for right-handed persons. The patient should be on the right-hand side so that you can use that probe in your right hand to scan the entire abdominal area. The head of the patient should be lying cranially, it away from you, okay? And the machine, it should be in front of you. So basically, to make a proper imaging so that you do not feel any discomfort, and you can just remember, because everything whatever you scan is a hand eye coordination. Initially you may have to think where you are placing the probe, but when you continuously repeat this exercise, you will be knowing where you are putting your probe, and your mind will automatically process that which organ you are evaluating. So for that you have to maintain a consistent position each and every time you perform the examination. It is not like you will take the transducer and you will just start scanning and you may find an organ, but that will be very incidental if you are not following any proper protocol. Now this is a wheat rough, which you can see. This is a wheat rough. It lets the patient to lie in a dorsal recumbency very comfortably. You can see no one is assisting, no one is holding the hands of the dog or the limbs. If the dog is cooperative, definitely if it is somewhat a bit less cooperative, then the owners or some assistant, they can hold the hand for you. But positioning in a V trough, it makes the dorsal recumbency very comfortable for the animal, and this dorsal recumbency is generally preferred for performing the sonographic examination. Although the examination can also be done in lateral recumbency or maybe in standing animal also. See here, if there are some gases, so gases, they will rise towards upward. So if we want to examine some structure like stomach or liver, when we cannot examine in dorsal, then we can perform in standing. Also we can undergo lateral recumbency, wherein we can scan from the dependent side, that is from the lower side, and then from the non-dependent side, that is the upper side. We can scan first in the left lateral recumbency, and then we can scan for the right side. These two pictures, they depict improper positioning for performing examination. Here we can see dog is turning away, the sonographer, the image is in front of the screen. So we may not be knowing where we are holding the transducer, in which plane the image is being formed, where is any structure, which structure is being represented on the left or on the right. So to understand all this, a proper positioning is very much important. This is again not a proper technique of scanning. Next very important thing is image orientation. Like for the radiographs, for the sonographs also, the image should be properly oriented. We must be knowing which structure we are seeing. So there are internationally accepted rules for performing sonography. If we are scanning in a longitudinal plane, so for longitudinal plane, always remember that the cranial portion should be represented on the left hand side of the screen, and the caudal, it will be displayed on right hand side of the screen. Okay, whenever we are performing any ultrasonographic examination in longitudinal plane, then cranial will be towards left and caudal will be towards right. How it can be accomplished? There will be a orientation mark on the transducer. I will show you that. So that orientation mark should be towards the thoracic region. Here I have given one example. Suppose we have to see a kidney. The kidney will have its cranial pole and the caudal pole. So we have to orient our image so that the cranial pole is displayed towards the left side and caudal pole towards the right side. Now, if we are scanning in the transverse plane, then the right side should be displayed toward the left and the left should be displayed towards the right. And for this, we should handle the transducer in a way that the reference mark is towards the sonographer, or we can say towards the patient's right. In this, suppose we are scanning a left kidney. So for left kidney, on the very left side will be the renal cortex, and medially towards the right side will be the hilus. So the thing which is towards the right side, that is the renal hilus, it should be displayed towards the left, and the cortex which is on the left side actually should be displayed on the right hand side of the image. So this thing you must keep in mind. Then only you can identify. Maybe later on, if you are scanning and you are just seeing through the images which structure was this, then if you are doing it in a proper orientation, then only you can identify it. So this is just a representation. Suppose the animal is in the dorsal recumbency and head is facing away from you, and in a longitudinal plane, you are placing your transducer on the ventral aspect, on this aspect. Then, as I have told, in every longitudinal plane, the cranial will be on the left. So you can see on the left side, on the left side, on the left side, it is cranial, and on the right side, it is caudal aspect. Okay. So, and on the top of the screen will be the place where you are placing your transducer. So if we are placing our transducer on the ventral will be displayed on the top. In longitudinal plane, if you are placing your transducer on the left side, the left will be displayed on the top, and if on the right side, then the right will be displayed on the top. Similarly, now if it is not a longitudinal, if it is a transverse plane, in transverse plane, as I have told, in the ventral aspect, right will be towards the left, and left will be shown towards the right. If we are putting it in the ventral, now slowly bringing the transducers towards the right side of the animal. This is the right side of animal because animal is in dorsal recumbency. Now the reference mark will be towards the dorsal side. Okay, so on the reference mark is generally present toward the left side. So this will be the dorsal, and away from this, this will be the ventral. This is the way you can understand where you are placing the transducer, then what you are seeing on the top, what structure is visible at the bottom, which structure is visible on the left hand side of the screen, and which structures are visible on the right hand side of the screen. This is see, in a longitudinal view, as I have told, if we are placing the probe over here, then if this is a kidney, definitely this is the cranial pole of the kidney, this will be the caudal pole of the kidney. How will I know? Only if I am using the proper orientation, then I can understand, yes, which area. This is the cranial pole and this is the caudal pole. What is its importance? Like suppose if I want to see adrenal, then I have to move towards the cranial. Towards the cranial, adrenal will be somewhere toward the medial aspect, and if I have to scan for ovaries, then I will go slightly towards the caudal side. So this is the importance of orientation. Now in the transverse view, this is the transverse view. Here you can see this structure, this is right, and this is the left of the screen. So for this, I have told we have to make sure where we are placing orientation mark. These, they can be represented in form of some elevated areas or in form of some dots or arrows or some colorful marking. So based on this, we can identify, yes, this is the transducer mark. And upon on the screen, it will be represented maybe as a dot, or it can have some other label also. Suppose it is a Philips machine, then it can have some P, or if it is a GE machine, it can have, means there will be some indicator which will indicate that this side is the orientation mark of the transducer and image is being formed from this side. Okay. So see, generally this orientation mark, it can be flipped. We can adjust like on left side also, on the right side also, wherever we like. There is a option to shift this orientation mark, but as per standard convention, most of the exams, most of the abdominal sonography examination, they are performed by keeping this orientation mark on the left side. However, in GE, this is GE, this is again indicator mark, it will be on towards the right side when performing echocardiographic examination. Then, after knowing the patient preparation, positioning, orienting the image, now we have to move the transducer. We know we have to perform some basic movements. So there are different type of movement. So in some we have to actually move the probe. In others we don't have to move the probe. We keep the probe steady and we just make some minor changes in the angle. So there are different types of movement. One is sliding or displacement, means we are actually moving the transducer. If we are going along the long axis, in recent literature it is known as sliding, means to and fro movement, going forward or backward. It is sliding. However, if we are going from left towards right, no angle is being changed, simply you are making the transducer go cranially or caudally, that is sliding. To the left and then to the right is sweeping. Suppose if we are not making any changes in the position, we are keeping the transducer at one place, but we are just giving some angle little bit towards the left and then towards the right. This is known as fanning. Other type of movements are rotation. Keeping the transducer at the same location, you simply make longitudinal to a transverse axis. You rotate the transducer by 90 degrees. This is known as rotating. Another type of movement of the transducer is rocking. Rocking, as you all know, like there is a rocking chair, na? We will sit on the chair and it will move to and fro. So that type of movement, which is seen in the, that is known as in plane motion. There will be in plane motion, slightly cranially and then caudally. So this is the rocking movement of the transducer. And the fifth type of movement is compression, or we can say pressure, in which we will just put the probe at the same position, but we can increase or decrease the pressure to make a organ visible in the field area. So this is pictorial representation. This is sliding. If we make the transducer go cranially and then caudally, this is sliding. As per recent literature, if we are making the transducer go on the left and right, this is sweeping. This is fanning. We are placing the transducer at one constant location but making some angle, like here towards the left and then again towards the right. So this is fanning. This is rotating, where we will make the transducer go 90 degree. And this is rocking, like a rocking chair. Again, see how the transducer will move, sliding from this place to this place. Face of the transducer is same, going to the cranially or caudally. This is sweeping, going to the left or to the right. This is rotation, making a 90 degree turn. This is fanning, slightly towards the left. Position is same, angle towards the left, angle towards the right. This is fanning. And this is healing. This is in plane. It is just 90 degree to fanning. In plane, you are making it go cranially and then caudally. This is rocking. So, correct way to hold the transducer. You should hold the transducer at the face, and it should be held in such a way that any manipulation which you want to do can be easily accomplished by just mere use of your fingers and the thumbs. You should not handle it towards the cable where it is attached, and you should not engage all your fingers to hold this transducer. Some of your fingers, they should just be able to provide support towards the animal. With these movement, you can just simply make any type of motion for the transducer, and you should not pay much force on the wrist. Like that, you have to handle the transducer, because we should have a very steady control. You will make a very minute displacement of the transducer, but in the image, everything will be gone. All the image will be gone and there will be a new image. They are reflected in a higher degree onto the screen. So now now you got to know the various movements of the transducer also. But after that, you have to scan organs. Like for X-ray, we say at least 2 orthogonal views are required. Similarly, for examining any sonographic structure, it is not that you have placed your probe at the bladder and you will say that bladder has been scanned. It is simply just one plane in which you are scanning. You have to scan it in multiple planes. So plane, it refers to the section through the entire body. Like we can say longitudinal plane, transverse plane, or dorsal plane. It is with respect to the animal's body, entire body. But when we say axis or view, these two terms, they should be used with caution. Plane refers to with respect to animal, but axis or view refer to with respect to the organ. See, like when we have to image the stomach, then the stomach, it is present a little bit obliquely and transversely within the animal body. So to obtain the longitudinal view of the stomach, which is with respect to the organ, you have to take transverse plane of the body. But for scanning kidney, if we want longitudinal scan, then it has to be done in that way. So you must be ensured what is plane and what is axis. And every time you save any image to your screen, then it should be properly annotated that this is the longitudinal plane of kidney or this is the transverse plane of kidney. Then only at a later stage you can identify when you want to review. So see, for scanning, for if we put the direction in the in as per this light sky blue color, then it is a longitudinal plane. This green one, it remarks the transverse plane, and the color in purple or violet, it is the frontal plane. So there can be basically three different type of planes. However, any organ cannot be seen exactly with longitudinal, transverse or frontal plane. We have to we may go for oblique views also to best visualize the image. So this is the longitudinal plane, this one, this is the transverse plane, and this is the frontal plane where we place the transducer from the lateral aspect of the abdomen, and then we see. So what are the basic image characteristics? Like as we have told, there will be reflections. If there are specular reflections, then it will be very bright, and this will give us appearance. Hello. Okay, I'll continue. For specular echoes, if there are, suppose there is a vessel wall, or maybe there is a diaphragm, which we saw in the last image also, last class also, that will appear very bright, and it happens when the beam they strike at 90 degree to that surface. However, non-specular echoes, they give details of the parenchymal texture. So there are various terms. It can be echo intensity, like as we discussed, the organ can be anechoic, iso, hypo, or hyperechoic. And the next term which are used are echo texture. We have to describe the detail of organ, where we have to define that yes, this organ is hyperechoic, this is isoechoic, this is a uniform echo texture, this is a non-uniform or coarse echo texture. So echo texture, it is based on the as I have told, every signal is represented in form of dots. So if these dots are very small, then we will say it is a fine echo texture. If the dot size is very large, then it is a coarse echo texture. If the spacing between the dots is almost similar, then we will say it is a homogeneous or uniform echo texture. If the spacing varies or size varies, then we will say it is a non-uniform or heterogeneous echo texture. So this is again the same thing based on dot size. If they are very small, we will say fine and uniform. If they are large, then we will say it is a coarse echo texture or heterogeneous. And for spacing, if they are very closely spaced, then we will say homogeneous or uniform echo texture. If they are widely spaced, then it is a non-uniform or heterogeneous echo texture. Then we must be knowing anatomy, where the organs are located. Then only we can know if we are placing transducer at most ventral aspect caudally, then yes, we will see the bladder, and below the bladder in a female animal we may be able to see uterine horns, or and then later on we can see the colon. So this can happen only when we know the anatomy of different organs in the abdomen. So suppose this is a dog which is placed in dorsal recumbency. We must have a brief idea. Like bladder will be located here. Below this will be the uterine body, and below uterine body we will see the colon. The colon, it will go here towards the left side, and then there will be transverse colon and ascending colon will be seen here. This sublumbar is the area of kidney, and here only the spleen will be located. This will be head of spleen. Tail will be somewhere maybe towards the bladder, or it can go towards the right side. Then this is the area of stomach. From stomach there will be duodenum. Duodenum will descend here, and this entire is the area of liver, left liver, right liver. So like that, we must be having the area of anatomy, and we should perform the examination systematically. Every time we should follow a particular sequence so that we can better identify and do not get confused with any artifacts. So everyone, they can adopt their own sequence. This is one of the sequence from our textbook. However, I do not follow this sequence. My sequence of examination is different, but I have taken this from one book. It really does not matter which sequence you follow, but Whatever sequence you follow that consistently, then only you can perform a thorough sonographic examination and do not miss any chance of performing uh, and losing any particular organ. So we will start with liver. As you all know, to perform this liver, it has multiple lobes and sublobes. Here you can see this is the left area, this is the right side. In left, there will be left lateral and the left medial lobe. Then it is quadrate lobe, right side, right medial lobe, and the right lateral lobe. Caudally, most caudal is the caudate lobe, and this caudate lobe, it has this papillary process and the caudate process. Here it has depression for kidney, in which the right kidney accommodates. This is the gallbladder, which is situated in between the left medial and the quadrate and the right lateral, right medial lobes. So this is the gallbladder. For performing the sonographic examination of gallbladder, either we can perform transabdominal or we can use the sonography instrument which is you have to place the transgate, the mid-sagittal scan of the liver, and after performing, this is the simple transducer placement, okay? And when we aim it cranially, see, when we aim it cranially, this is the rocking motion of the transducer. Then we can see a liver much dorsally to get access to the most dorsal aspect. This is one of the motion. So initial scanning will start at the level of post-deferred, and then this is the liver, like eco texture. I told it can be fine or it can be coarse. So liver, it has a coarse eco texture because distance is very much separated. There are very vessels. Porta hepatis is the area where all the portal vein, hepatic artery, and bile duct, they will enter and exit the liver. Okay. So in this parenchyma, we can very easily identify portal vein. They are very easily seen. They have very thick, white hyperechoic wall. And for hepatic artery, visualization is difficult unless we have color flow imaging. But yes, they don't have very white wall. They are simply seen as having anechoic contents. Bile duct, it is generally not seen in dogs. However, we can see the bile ducts in cats, and it can be up to the size of 3 mm diameter. So portal veins, as I've already told, these are the dominant vessels. They have a white colored outer layer because of fibrofatty connective tissue, whereas hepatic veins, they do not have well demarcated white colored wall. And it is generally these hepatic veins, they drain into the caudal vena cava. So this we can see in the transverse image. For gallbladder, it is a round or oval structure. The contents are anechoic. However, with time, the contents may become echogenic in normal conditions also, like in adult age dogs. The wall will be echogenic, and location I have already told, it is located between quadrate and right medial lobe. The location can be very variable depending upon the level of distension. It can be in midline towards the right or towards the diaphragm, depending upon how much distended the gallbladder is. We can, if it is mildly distended, we can follow up to the neck of the gallbladder, but the cystic duct is generally not seen in case of dogs. So after performing the initial scanning, placing the transducer post xiphoid, we will do fanning. This is the fanning motion. We will go towards the left of the animal and then towards the right of the animal to scan the longitudinal view in multiple planes. Okay. See, we can displace the transducer towards the left to see the left hepatic lobe and then towards the right to see the right hepatic lobes. Here, this is longitudinal canine liver. This is the lung diaphragm interface. It appears very white, bright, echogenic. These are the portal vessels with echogenic wall layered, and hepatic vein, they are not having any arrows. Now this is the transverse section. In the transverse section, I told this is a hepatic vein, and this hepatic vein it is draining into the caudal vena cava. This is portal vein. This is the liver. It is having coarse ecotexture, and this is gallbladder. Gallbladder, I have told it should be anechoic, but here you can see very much ecogenicity. Yeah. Whenever there is viscosity, some cellular content will rise, then the gallbladder will show ecogenicity. Now this is a transverse view of the liver in short axis. Here you can see these are the hepatic veins. The walls are not, and these are the portal veins. In portal veins, we can see bright ecogenic wall, whereas in hepatic veins, there is no such ecogenicity. Now, like I told, we can scan in longitudinal towards the left and towards the right. So it is a longitudinal section. And I have told image orientation also. When we are placing the transducer from ventral aspect, so this on the top will represent ventral aspect, and this will be the dorsal aspect. This is the cranial portion, which is towards the left, and this is the caudal portion. So anatomically, now we can understand when we are scanning a liver on the left side, cranially liver is located, and caudal to the liver we can see portion of stomach. Okay, and this is not a portion of liver. This after this bright white light in this near field, it is falciform ligament. Generally, it is having somewhat isoechoic nature as compared to liver parenchyma, but we have to understand that these are the liver margins. Image can be optimized by using THI mode also. Now, this is gallbladder, which is distended, mildly distended in the liver. These are portal veins, and here you can see some ecogenicity is there. It can represent biles, biliary sludge, or this sludge can be pathological or non-pathological. That we have to decide. Okay, and this ecogenicity can normally be seen in cats. In cats, it is not pathological. So here you can see in the liver, you can see these two lobe structure. This is bilobe. So it is a normal finding in cats. In cats, the gallbladder can be bilobed. Here see, we may think that the liver is extending up to this region, but no. In cats, the falciform ligament, this is the falciform ligament, and this is the liver. See, because in that fat there will be very much high ecogenicity. We can see these white lines. This is not the ecotexture for a liver. Liver is starting from here. The white arrow portion, it is falciform ligament, and beyond this portion, this is the liver. Now, this is a transverse view of left abdomen. So, in transverse view, I have told on the left, it will be the right-sided structure, and on the right, it is the left-sided structure. Here on the right, we can see this is the liver lobe, and here on the right, spleen, which is generally present on the left side, it is represented towards the right. And we can see this spleen is brighter as compared to the liver. So, spleen is hyperechoic, and the liver is hypoechoic, which is a normal finding. So after liver and gallbladder, the next organ to be examined is spleen. Spleen generally it is an elongated solid organ, and it has three parts: the head, body, and tail. And we have to scan the entire spleen. Otherwise we may misdiagnose. We may miss any particular lesion if we are not performing a thorough examination. So the size of spleen in dogs is variable. Like German Shepherd, they have very large spleen as compared to other. And otherwise also spleen in dog is large and massive. For cats, it is a small structure. Generally, the thickness is less than 1 centimeter and length is up to 4 to 6 centimeter. Now, while scanning the spleen, we will be seeing a splenic hilus. In this, the splenic vein enters. And for identifying the spleen, the important landmarks are stomach, colon, and kidney. So we identify, and the spleen is stomach is generally present craniomedial to the spleen. The left colic flexure or colon, they are present dorsomedial and caudally. And kidneys, they can be seen. If in far field we talk, in the near field, then we can identify by colon. In the far field, we can identify by kidney. Normal sonographic features means spleen, it will generally be iso to hypoechoic in comparison to the surrounding fat, and it is hyperechoic to the liver. The capsule of spleen, it will be very bright, it will be hyperechoic. The ecotexture is homogeneous. For liver, the ecotexture was heterogeneous, it was coarse, but for spleen, the ecotexture is homogeneous. That means the spacing of the dots is very equal, very balanced. However, if we use a high frequency transducer, then this fine ecotexture can get converted to coarse ecotexture. Why? Because with a high frequency transducer, there will be better resolution of the near echos. So, for canine spleen, it is generally located in the left cranial and ventral abdominal wall. It is located somewhat ventrally, and because it is very large, the attachment point is only single, that is the gastrosplenic ligament, where it is get attached to the greater omentum. So rest of the portion, that is the tail portion, body portion of the spleen, is very mobile. It can attain different position. It can go caudally and then impinge upon to the level of urinary bladder, or it may take a course towards the right side. From left side, it can bend towards the right side, so it can give a curved type appearance. However, in feline, because the spleen is very short, one thing, in dogs it was located ventrally, whereas in cats it is located on the left side towards laterally. So as I told, we must scan it completely. However, even after scanning, if there is some pathology, it is not necessary we may find some changes. So a normal scan never rules out the disease. So for scanning technique, what we will do, we will first locate the head of the spleen, and then we will slide tracing the body of the spleen, and then we will move towards the tail of the spleen. Head is the only portion of the spleen which is very consistent in its location. It is located cranial to the kidney, and head it generally folds on itself. So it will give us appear like it is a curved. So head is the most consistently seen, and spleen, the tail of the spleen, it is mobile. It can change its location. See, transducer position for scanning the spleen towards the left side, caudal to the left kidney. Here, this is the first scan. In the first scan, when you are placing it towards the left, it is the head of the spleen. This is the body of the spleen, and later on, it will go somewhere towards the tail of the spleen. Head, as I have told, it is curving. There is some angle. Here it is curving. So when we place the transducer at this position and angulate it cranially, then we will be seeing the head. The image will be like this. And this head, we will get up to entire depth. As much as deep it is, we will see it completely. Then we will start sliding the transducer following towards the body. This is the second scan. So here we will see the image of body. This is the body of the spleen cranially, and then we will slide further caudal. Then we will see mid portion of the spleen. Why? Because I told it is an elongated structure. So in a single scan, in a single screen, we cannot visualize the entire portion of the screen. We can see that only some portion of the screen is visible. Cranially and caudally, these portions are not into the scan. So we have to slide the transducer to get the complete image. And then we will come towards the tail area to scan the tail of the spleen. We have to perform thorough examination. We cannot say that we place the transducer at C location. We saw the spleen is very fine, it is very uniform, but maybe there is a lesion which is located towards the tip. There is some nodular region in the tip, then we will miss it. So we have to scan it thoroughly. So see, these are the sonographic pictures. This is the head of the spleen. I told it will occupy a complete depth. This is the head of the spleen. Then this is the cranial portion of the spleen body. Then this is the central portion of the splenic body, and this is the tail portion of the spleen. Here see, this is the splenic head. Here body will start, the splenic head, it is curving, it is slightly curving, and it is occupying up to this depth. This is the head of the spleen. Now This is the body of the spleen. We can see this is stomach, because stomach was one of the landmark to visualize the spleen. It is located cranially towards the left, and then it is going beyond the stomach, and it will go maybe up to the level of urinary bladder. Here you can see this is the tail. Now this is probably an enlarged spleen. However, for cat, we can see most of the spleen can be seen in one of the scan, and the width will generally be less than 1 centimeter. The length will be somewhere around 3 to 4. Now this picture, what it shows, when we were using a low frequency transducer, the spleen was appearing very fine. This is the fine ecotexture of the spleen. But when we switched to a high frequency transducer, which is having somewhat better resolution, the ecotexture changed. Okay, the ecotexture changed, it is appearing coarse. And now this point, if you can see now, this is the splenic hilus, this black color structure. This is the splenic hilus from where the splenic vein enter. And near to the splenic hilus, there will be splenic nodes. So here in this case, we can see that the lymph node, the splenic lymph node is enlarged. Here also, this is the splenic lymph node which is enlarged. After liver and spleen, next organ which we will discuss, they are kidneys. They are generally paired ovoid structure which are located dorsally in the retroperitoneal cavity. For kidney, we will see there is a cortex, then there is medulla, there is renal sinus, there is a hilus. In hilus, renal artery, vein, artery enters, and vein and ureter, they exit the kidney. Left kidney, it is related to the head of the spleen, caudal to the head of the spleen. And the right kidney, it is present more cranially. I told in the caudate lobe, there is a renal fossa in which the right kidney, head of the cranial pole of the right kidney fits. So right kidney is placed a little bit cranially. Left kidney, the level will depend upon the degree of stomach distension. It is a little bit caudal. Size is variable depending upon the body weight. In cats, the kidney are short and round. So for scanning technique, we can perform in lateral or in the dorsal recumbency. Any recumbency we can perform. For left kidney, we have to place the transducer at the level of left paralumbar fossa. And for right kidney, caudal to the last rib, if we can see. Or otherwise, because I told, if it will be a deep chested dog, then as the liver will be in the rib cage, right kidney will also be displaced slightly cranially. So we may have to undergo intercostal approach also for seeing the right kidney. The transducer, for cats and small dogs, we can opt for high frequency transducer, whereas for large breed dogs, a low frequency transducer is used. So these are various techniques. I told different planes, na? The kidney should be imaged in 3 different planes: longitudinal, transverse, and the dorsal plane. So this one we can see it is the dorsal plane of the kidney, where in the dorsal plane we will see the renal cortex, then the renal medulla, and the renal sinus. Only near cortex will be seen, the far cortex is not seen. In the transverse, we will see one section, and in the longitudinal, like any section, this cortex, how the image will appear, I will show. These are different planes. In longitudinal plane, we will see cortex, medulla, there will be renal diverticula. In transverse plane, we will see a rounded structure, rounded or triangular shaped structure. And in the dorsal plane, we will see beam shaped kidneys. So generally, cortex, they will be echogenic. Medulla, it will be hypoechoic to anechoic. And in the medulla, there will be vessels. The vessels, they will be having parallel. They will be parallel, and at times there may be shadow, but stones will cast shadow from them. This is longitudinal scan of the kidney. Now this is a transverse plane of the kidney. In the transverse plane, you will see round shaped structure of the kidney, and here we can see comparison of renal cortex, and a portion of liver is seen with the liver. Both of them are isoechoic. Now this is the dorsal plane. In dorsal plane, the far cortex is not seen. Only the near cortex, medulla, which joins at the sinus. This is the area of sinus which is the most echogenic. So cortex, then medulla and sinus. Far cortex won't be visualized. It will give the bean-shaped appearance of the kidney. After kidney, next organs are urinary bladder and the urethra. For bladder, that the bladder is moderately distended, and we can undergo any frequency transducer depending upon the size of the animal. For female dogs, we can at the level of last two mammary chains, or in male dogs, we can select at the level of parapreputial area. And for urethra, we will scan a little bit more caudally at the area of trigone of the bladder, and then we will ambulate slightly caudally to see the urethra. In urethra, only the can be visual, because the other parts, they are under the pelvic cavity, and we cannot visualize anything through the bone. So for normal features, the contents, they will be anechoic. Wall will be generally less thick. It depends upon the size, level of distension. Suppose if the bladder is very minimally distended, definitely the level of at any time, the bladder wall thickness will be less than 2.5 mm. When the bladder, it is markedly void, then we can just misdiagnose. There can be some irregular thickenings which we can see, and we may suspect cystitis, which actually may not be present. So if we are performing any scan in which bladder is not distended, then what we can do, we can perform entire abdominal scan, and at the last we can re-examine, or if required, we can put the animal on IV fluid, or we can just simply use a catheter to distend the bladder. But if we distend the bladder by using catheterization, some air bubbles may go inside, and then again we can get confused. These air bubbles, they will have different echogenicity, and we may think there are some floating particulates in the bladder. So these are various views for performing sonographic examination. In male dog, we will generally perform at the level of parapreputial area. If the bladder is very markedly distended, then we can place the transducer slightly cranially at the level of preputial orifice. In less distension, we will place it caudally. We have to scan the bladder from the apex to the trigone. We have to fan in the longitudinal plane from left to the right to scan every details. Then we have to scan in the transverse plane. We can also use different recommendations. Suppose if we are getting confused about some sediments, then we can just turn the animal around, and we can make it in standing position to perform the sonography. Sorry. So this is pictorial representation. This is the bladder. The ureters, they will enter at the area of trigone. Dorsally, they will enter into the urinary bladder, and urethra, it will leave from this trigone, proximal part of the urethra. Ureters, they enter into the, this is the uretrovesicular junction. This is the dorsal bladder wall. This is the ventral bladder wall. We can measure the thickness of this bladder wall, which should be less than 2.5. Now, if there is, suppose distension is less, then we can demarcate various layers of the bladder. But when it is mildly distended, it will be less, the thickness will be less, and these distinction of the layers of the bladder, like mucosal, submucosal, and muscle and serosal layer, it will be difficult. It can at times be seen. Now here you can see again, this is the cranial portion of the urinary bladder, means it is towards the apex. This is the caudal portion of the urinary bladder towards the trigone. And here, after the trigone, if the bladder is very mildly distended, we can trace it back up to the level of proximal urethra. We can see the distension in the urethra also. Now, next to the bladder, I told we can examine for the prostate also. We can get a window at this prostate. It is located at the neck of the urinary bladder. This is the longitudinal scan of the prostate. Prostate generally is a bilobe structure. It has a left lobe and a right lobe. In the longitudinal way, we can see like this. And this is the transverse. So, in transverse, this lobe, which we see on the right side of monitor, is actually the left prostatic lobe, and on the left is the right prostatic lobe. In between is the area of urethra. Urethra travels in between these two lobes. After this, we should know about GIT. In GIT, sequentially we move the stomach, duodenum, jejunum, ileum cecum, ileocephalic junction, and then the colon. So stomach, if we have to see in the longitudinal axis, then we have to take the transverse. In longitudinal axis, if we are scanning, then we will get the transverse view of the stomach. And if we see in the transverse axis, then we will get the longitudinal view of the stomach. I have already told, axis is with respect to the animal and view is with respect to the organ. So for starting the scanning, there will be cardia, which will be very rarely seen. After the cardia, there will be fundus portion. Fundus is present in the left craniolateral quadrant. It is towards the left side. Then transversely there will be body, and it will go towards the right side. That is the pylorus. So body is close to the midline, and pyloric antrum, it is towards the right side. In cats, instead of going up to the extreme right, the pylorus, it will start at the level of midline. After this, it will continue at the pyloroduodenal junction to the duodenum, and this duodenum in dogs will be located just towards the right side ventrolateral abdominal wall, and in cats, because the pylorus, it ended at the midline, so duodenum will be seen in the midline. Then jejunum will be spread in the entire abdominal cavity. So for scanning the jejunum, we have to scan like as we do the TLC, any blood cell count, a row up, then to the right, then down, then to the right, then up, then to the right. So we have to make multiple different sweeps in different direction to scan for any abnormality into the jejunum. And then ileum, we can identify the ileum, which is very short, and it is present on the right side. Ileum is present on the right side, mid-quadrant area. And this ileum, it will continue up to the ileocolic junction. Cecum generally is a blind sac. Then next is the colon. For colon, after the ileocecal junction, we will go cranially to scan for the ascending colon, then transverse, and then we can go caudally to see the descending colon. For the transverse colon, it will be located caudal to the long axis of the stomach. Cranially will be the stomach, caudally will be the transverse axis of the this transverse colon. And then this will descend as a descending colon. However, for colon, what we can do, we can use a reverse approach also. In reverse approach, first we will identify bladder as a landmark. And below the bladder we will see the colon. We will trace the colon on the to the left side, that will be the descending, and then we can see the transverse and ascending colon. So this is reverse approach. Now for GIT, what will be the normal features? First thing we should take care is fasting of the animal, because otherwise there will be multiple gases which will lead to artifacts. Next is the appearance. The appearance of the GIT is layered. Why layered? Because all the layers, the serosa, muscularis, submucosa, and mucosa, and also the lumen, they have their different acoustic impedance, because of which appearance of all these layers is very different. So it will give a layered appearance, and we should assess the intestine, that whether the diameter is uniform, what is wall thickness, is there any discrete layering, are any contents, and what is the level of peristalsis. Is it hyperperistaltic or hypoperistaltic? So this is the thickness. In generally in dogs, the stomach thickness should be up to 5 mm. It should not be distended more than that. Duodenum is the thickest portion of the intestinal segment, the thickness in the all the bowel. So duodenum is the most thick, and you can see the thickness of colon, it is not very markedly thick. So this is that layered appearance I was talking about. This white, bright in between is the lumen. Here mucosa, these two lumens, they are sticking to each other. This is hyperreflective. So this is the lumen. After the lumen, this black colored structure, this entire, it is the mucosa. After the mucosa, this whitish structure is the submucosa. Then submucosa के बाद क्या आएगा? It will be muscularis. Muscularis again is the black colored structure, and after muscularis, this white structure is the serosa. So this is the layered appearance of intestine. Again, lumen, the mucosa black colored, the submucosa white one, then muscularis black one, and then the serosa white one. So this is the general appearance of most of the intestinal segment. Here, this is the stomach. This is the longitudinal scan of stomach in a cat. Here, what you can see, these are the rugal folds, because stomach, they have rugals, and this is the area where there is a gas or maybe some food particle or mucus which is sticking, because of which there is a lot of dirty shadowing. This is the reverberation. We can see these reverberations. And this is the layered appearance. Lumen, after lumen, mucosa, the submucosa, muscularis, and the serosa. So the thickness will be, we can measure the thickness. While measuring the thickness, we must ensure that we don't have to measure at this point. Here there are rugal folds which will give us a wrong diagnosis that the wall is thickened. We have to measure the thickness at a non-rugal area. Now again, this is longitudinal scan of stomach of a dog. Here again we can see reverberation, the dirty shadowings. Now this is the transverse appearance of stomach, or when the stomach is very empty. So in this, these are the folds we can see. It gives a wagon wheel appearance, just like a wheel. We can see these like spikes. So this is the transverse view of the stomach. Now this is a portion of duodenum. Duodenum is the most thickest portion of the intestine. And here you can see this. See, again, if we talk of the layering, this is the lumen. After the lumen, this is the mucosa, this is the submucosa, and then serosa. So this is an extension of mucosa. In duodenum, we all know that there are Pier's patches. So this is a portion of submucosa, which is no focal lesion, but instead they are the Pier patches. Here also in the duodenum, we can say in between, equidistantly placed Pier patches can be seen. Now this is portion of ileum. In ileum, we can see this layer, submucosa. It will be more thick. So we can see more of hyperreflective layer. This is the ileum. And this is the ileocolic junction. See here, this this is the ileum, which is continuing with the colon. In colon, most of the time there will be feces or gases, so it is casting shadow. So here ileum is in junction with the colon. This is the ileocolic junction. Now we can see liver, then stomach, and I told you transverse colon. When we are scanning transverse colon, then stomach can be used as a landmark. Colon transverse colon is present caudal to the stomach. On the left is the cranial, on the right is the caudal. So transverse colon is present caudal to the stomach, and stomach is present caudal to the liver. Here we can see bladder, and below the bladder we can see colon. In colon, generally, we will see only the near wall of the intestine, and we will not be able to distinguish the layered appearance of the intestine, because feces and gases, they just attenuate the layer, nothing else propagate deeper. However, in case okay, this is again that ileocolic junction. Yeah, right. So yes, we are done with the major organs which needs to be identified into any particular abdominal scanning. The list of organ is even more. Like, I did not include uterus or ovaries, or like organs like pancreas, because sometimes they may be difficult or challenging to trace when we are just beginning our scanning journey. At least these are the major organs which we must identify. So with this, we will conclude the second session, and for any doubts, you can ask. Hello. Hello.
Hello, good evening, ma'am.
Yeah. Hi, Dr. Yajish.
Will the uterus be included in the next lecture, or is it just skipped?
Uh, Actually, your voice is breaking. Can you please repeat?
Ma'am, I'm saying that will the uterus be included in the next lecture?
Okay, you want to know something about uterus. I will add the images in the next section, but actually, for general scanning, in routine, the uterus, if the animal is nulliparous, it has never given any birth to, okay, then it is very difficult to visualize the uterus. It is generally not, maybe we can say not at all seen, if it is not associated with any pathology. When there is a pathology, suppose there is pyometra, then the size of it will be enlarged and we can see it. But in normal condition, to view the uterus can be somewhat difficult. If required, I will add the images.
Okay, thank you, ma'am.
However, see, I will tell you, for the location will be just next to the bladder. We will see the bladder, and if there is uterus, then we have to locate it below the bladder, and only after that colon will be there. Okay.
Okay, ma'am.
Any other questions? Okay. I feel now there are none.
Ma'am, can we see momentum and other things as well? Like, can we appreciate them on USG?
Sir, actually, for momentum, if there is any lesions which are associated, then we can see. And for better visualization, I have told that other special instruments like stand-off pads and all these will be required. However, in the routine practice, I never found like when we need to specifically see for momentum. In routine scanning, I have not seen it.
Hello, ma'am.
Hello.
Hello. Yes, ma'am.
Yes.
And about like ligament, we have broad ligament and suspensive ligaments and
Yeah,
other things
that
of like.
definitely, yes. Yes, we can see any pathology associated with those ligaments, but that was like another topic. It was not in the purview of this. That is related to musculoskeletal. It is definitely very commonly used, especially in equines, where there are lot of tendon injury, ligament injuries, So we can definitely
No,
see.
I'm asking like no, I'm asking about like we have like uterine body, we have the horns, we and the ovarian attachments like suspensory ligament, broad ligament, ligament. Can we appreciate them on USG without any pathology?
Actually, for your questions now, but when you think in normal cases, in most of the cases, I have never seen any pathology which is generally associated. Yes, but definitely there is some lymph nodes which are associated with them, and any associated lymph node is enlarged. That can be seen. Some visceral lymph nodes, if they are enlarged, that can be seen.
Ma'am, how can we visualize transverse and longitudinal section?
uh, See, one thing is view and the other thing is axis. So you have to make sure longitudinal means we are placing. I have just 1 second. Maybe I'll go to that image again. So longitudinal, this is plane. This is with respect to the animal body. Anytime we are placing the transducer in this direction, it means we are placing it longitudinally. If we are placing it like this, that means we are placing it transversely. And in purple line, it will be the dorsal scan. So this is with respect to the animal body. But now, now see here. Suppose we want to scan the stomach. How the stomach will be, somewhere on the left there will be cardia, then there will be fundus, the body will be till this area, and on the right side there will be pylorus. So actually the stomach is lying transversely, a little bit transversely within the body. Longitudinal scan, for obtaining the longitudinal view, in the longitudinal view transducer is to be placed here like this, straight. But if we want to scan the longitudinal axis of the stomach, then the placement of transducer will be like this. It will be a transverse view of the animal, but it will be a longitudinal axis of the stomach. Is it clear?
Okay, ma'am. Yes, ma'am. Thank you.
Okay, thank you. If something, anything, anyone is feeling or anyone is believing that it was missing in this lecture, I will try to include it into the next lesson. So please feel free to ask. I will add. Intentionally I have restricted this. I had even more slides, but I have intentionally restricted it so that people may not just simply get confused. Okay, any other doubts?
Ma'am, please check chat box.
Chat box. Uh, Dr. Karamvi, can you please read the questions for me? I don't know where they are. Chat box.
Could you please mention how we can establish the liver enlargement?
Yes, this is a topic of next class. However, still, like for enlargement, the size of liver is not fixed. We cannot say that liver will be like this. In next, I will tell you. But as I have told, like we can see, the liver is generally into the level of it is inside the rib cage. So we will see that the margins, they are protruding beyond that level. Or we can assess by the size of the renal fossa. I have told that in the caudate lobe there is a renal fossa. So by seeing that size, whether how much kidney, till the level of which it is reaching up to the level of kidney. So by that, we can get a subjective evaluation of the size of the liver.
Ma'am, one more question. How to relocate pancreas?
Okay, okay. The pancreas, they are a little bit tricky, but for locating the pancreas, what you have to do, you have to scan from the right side. Or there are two parts. One is the limb of the pancreas, the right limb and the left limb. Okay, you have to scan from the right side. First you will see the duodenum, and once you see the duodenum, you have to go a little bit medially. You have to reach up to the level of then medially you will see that limb shaped structure, somewhat triangular structure. And in the pancreas, most differentiating feature, most distinct feature will be the presence of pancreatoduodenal vein, which will appear little bit anechoic. I will add one picture in the next session for the pancreas also, how they are looking. But the way to identify is, first you locate the duodenum, then you go a little bit medially, and then there you can identify the pancreas. So for uterus, for pancreas, I will add slides in the next lecture.
Ma'am, is there a cheat sheet to remember all this information and concerns with?
Sorry.
Is there a cheat sheet? Is there some trick to
No,
be
no,
able to
no,
remember
no. I
all
don't
these
think there is
things?
any cheat sheet. I don't think there is any cheat sheet. I have used none. All this, all this is simply by how many times you will repeat it. And in every sonographic examination, are you just simply, if you are interested in bladder, so are you scanning only the bladder, or you are following a protocol wherein you will scan the entire abdomen? So make it a habit. Try to locate each and every organ every time. Maybe you will have to spend some time. Don't hurry, don't rush up that you have to just simply scan it in 5 minutes. Give it some time. Then it will be it will be a second thought. Your hand will be on the animal, and you will be knowing, okay, now this is the bladder, now I have started moving to the left, now I'm seeing the spleen, and then next to the spleen this is the kidney, now this is cranial pole of kidney. For adrenals I have to go a bit medial, see, and then I have to scan for artery. There I will see some grounded shape structure. I have to locate ovary. Okay, now maybe I have to give 5, 10, 15 minutes, but I should best give my try to locate the ovaries. Then only, maybe I will not see in the first animal, not in the second, not in the third, but maybe at the 10th or 15th, I will see it. And once I see, I will develop the confidence. Yes, now I have seen. Next time I will be able to locate it more confidently. And for every scanning, if you can schedule, try to schedule it. You will see a lot of improvement in the image quality. Because when the animal will be fasted, there will be less barriers to the sound waves. You will get better echo windows. You can scan from multiple planes. Otherwise, what happens whenever the animal is coming, most of the scan is obstructed by the gas within the bowel. So we may fail to get good images in all the animals at every time when we have to perform a sonographic examination in emergency.
Ma'am, how to differentiate between the duodenum and jejunum?
Between the duodenum and jejunum, okay.
Yes.
Generally, what I told, duodenum, it will start at the right quadrant. It will be located in the right hand side. When there will be pylorus, it will end at the right, then there will be pyloroduodenal junction. So duodenum will be located in the right cranial right quadrant. It will start from there and it will lie more superficially. I told you first there will be duodenum, then followed by duodenum, there will be pancreas. So when we slide it laterally and caudally, we can scan throughout the duodenum. The next thing is, duodenum is the most thickest portion of the intestine. I told the thickness of the duodenum is higher, and jejunum, they are not very much thick. They will be present throughout the abdomen. So for that, we have to scan the entire abdominal area.
Ma'am, is there any book available to learn all these things?
Sorry, your voice is very much breaking. I cannot hear
Ma'am,
you at all.
I'm saying like, is there any book available in the market we can study to learn all these things?
Okay,
Like,
Nyland Matone
yeah.
is one of the very good book. Nyland Matone is the best, I would say.
Any Indian author, ma'am?
Actually, I don't think there are any good ultrasound books from Indian author till now. But Nyland Matone and Panic Anju, these two are good books.
Ma'am, which is the cheapest and the best machine to use for like all these things? Best and cheapest machine.
For that, maybe I don't have an exact answer where I can help. See, one thing is the range, like when recently only I was trying to search for a machine. It A good machine can come within 10 lakhs also, and the ranges when we are talking about veterinary specific models where they are having pre-installed packages, it was into the range of 67 going up to 80, 90 lakhs also. So the machine cost will depend on many factors like which and which transducers you want, which modes you want. You want most basic B mode only, or you want some advanced M mode also, you want a Doppler package also. So based on that, for this I cannot give you an exact answer, but the range is highly variable.
Ma'am, can we use human use machine for the animals
Yes,
as well?
definitely,
Like
definitely we
humans.
can use. Only thing, what will happen when we are using human machine is that human machine does not have pre-installed packages in them. But what is the purpose? They just simply give you some idea of calculations. They will give you instant veterinary specific machine. They will give you an instant calculation. For that, the cost is increased a lot. But if we have a human machine whose cost is less, with almost all the similar features, the price range will vary in double, a factor of a double. So in human machines, we can simply use some Excel sheets where we just put the pre-available formulas, and from that we can calculate. So definitely, human machines are as good as veterinary, and in fact, the human ultrasound is a technique which is in its much advancement. So their machines are much better as compared to veterinary. See, I told a machine is as good as sonologist. This is one thing also, na? How much you will optimize.
Ma'am, one question from Naveen Kumar. Ma'am, could you please repeat the initial slide where you mention the dot separation from ecotexture?
Dots and good. Yeah, sure. Mm, wait. This one, na?
Yes, ma'am.
See, when the dots they are very small, then it will be a fine ecotexture. Example is spleen. When the dots they are of large size, then it will be coarse, like a liver. Then uniform and non-uniform. If the spacing is almost consistent, small size dots which are very consistent, then it is a uniform, regular. And non-uniform means the spacing is disturbed. It This non-uniform ecotexture it can happen during some pathologies. So I will show you the slides in the next class where you will see the examples of non-uniform ecotexture.
Ma'am, next slide, please.
Next slide.
Yes, ma'am.
Yeah, sure. Based on size, if they are small, the size can be small, medium, and large. When small, it is known as fine. When large, it is known as coarse. For uniform, the spacing will be based on dot spacing. When they are very closely spaced enough, then it is a uniform. And for when they are not closely, when they are placed widely, then it is a non-uniform. So this here also, na, in size also, this uniform and non-uniform, it can happen based upon the size and based upon the spacing. But based on size, it will be fine ecotexture or it will be a coarse ecotexture. Uniform or non-uniform, it is a combination of size as well as spacing. However, fine or coarse is a matter of size.
Ma'am, can you please repeat the name of the book about ultrasonography mentioned earlier?
Yes, it is Nile and Matun.
Ma'am, can you please type in chat box if possible?
I don't know where is the chat box. I will type in the group.
Okay, ma'am.
I can share it in the group.
Okay, ma'am.
Okay.
Okay, ma'am.
Any other doubts?
No, ma'am.
Okay. Even if there are some, then that can be discussed in the next class also. So, thank you very much.
Thank you, ma'am.
Yes, all the abnormalities we will discuss in next class. Abnormalities we will discuss in next class. Thank you all for your patient hearing, and we will meet tomorrow for the third and the final session of this series.
Thank you, ma'am.
Thank you very much.